a running Mentimeter. Sorry, we do have a running Mentimeter where you can pose questions anonymously throughout the discussion. You can access it via the QR code that is on our screen or the link in the chat. Michelet and Shani will be helping us gather the questions, which we will address once the speakers have completed their presentations. Today, we have 3 speakers joining us. Our first speaker is Dr. Ingrid Daniels, the Chief Executive Officer of community-based mental health organization, Cape Mental Health, and past president of the World Federation for Mental Health. Thank you, Ingrid, for making time to join this webinar. I'd love to hear from you. How have you prioritized mental health in the workplace? Over to you, Ingrid.
Good afternoon, Bharti, and good afternoon to all our colleagues and all those present here today. This is such an important conversation because we have to prioritize mental health in the workplace. We have no choice. It's no longer negotiable. But I want to share with you the work that we do. So if I could please share my screen, that would be great. Thank you so much. So once again, thank you for the opportunity to share some of our practical intervention plans that we have as an organization. And it's wonderful to be here at the South African Federation for Mental Health's World Mental Health Day event and webinar. So as we know, the theme for this year's World Mental Health Day is, it is time to prioritize mental health in the workplace. But before I speak about our specific interventions at Cape Mental Health, I wanted to contextualize what I want to say and why it is so important that we prioritize mental health in the workplace. We all know that work can be a protective factor for mental health, but it can also contribute to potential harm. Almost 60% of the world's population is in work. All workers have a right to a safe and mentally healthy work environments. Globally, it is estimated that here it is, 12 billion working days, ladies and gentlemen, 12 billion working days are lost every year due to depression and anxiety, and it costs us globally over $1 trillion per year in productivity. 15% of the working age adults live with a mental health condition. So we find people in our workspaces who have a diagnosis. So creating workplaces and safe work environments for people with mental health conditions remains essential. The World Health Organization goes a step further and says that work and mental health are closely intertwined, and we know that. A safe and healthy working environment supports mental health, and good mental health enables us to work productively. An unsafe and an unhealthy working environment can undermine mental health, and we know when we have experienced poor mental health, it interferes with our ability to perform. And if left unsupported, the problem can escalate. And so our staff in the mental health sector, and specifically at Cape Mental Health, we have found that there are major stressors that impact on their working lives as they provide mental health resources and support in very dire resource disadvantaged communities. They are often exposed to crime, violence, trauma, the impact of drug addiction on communities, gang violence, and those nasty social determinants of mental health, such as poverty, and largely also the difficulty we face with a non-responsive healthcare environment, a very fragile health system, where services are often delayed in the areas and spaces we work, family trauma, grief and loss, and the list is endless. it is often not a pretty picture. And so the question you may then ask is, how does Cape Mental Health address mental health in the workplace? What are some of the practical implementation plans that we have? And so our focus has largely been in 3 areas: supporting a mental health and well-being environment and support for our employees. And this could include, and it does include, persons with lived experience as well. Mental health service users who need support within the workplace, and then corporates and NGO who also need to have mental health and well-being programs. But that group is much larger, and it's across all sectors. So let's start with our staff. We have a very clear policy statement on mental health in the workplace, which confirms our commitment to support mental health and well-being of all our employees. And this program of ours rests within a particular structure called Care Internal, who is largely responsible for the caring of our staff's mental health and well-being. Our staff are the human capital, an asset to the organization. And therefore, it is imperative that we provide, as a lead mental health organization, mental health support. Our policy and the programs are implemented through the structure and facilitates the following. We provide employee assistance programs, and Cape Mental Health is committed to ensuring the welfare of all its employees. And the aim of the employee assistance program is to offer internal, professional, confidential counseling to employees who may need help with a particular problem at a particular time that affects their well-being, both personally or professionally. We also provide childcare support to staff. And these would be to mothers who return after maternity leave. They are allowed to bring their babies to work to facilitate breastfeeding and support, and provide an environment which is safe, protected, and supportive. We also support other childcare arrangements depending on the circumstances or situation. But furthermore, we have an active wellness afternoon off. It's fondly known as the duvet afternoon off. And managers can identify staff who've gone over and above the call of duty, who need to have just that afternoon off for themselves. Team building. We have active team building across the organization, and team building is a wonderful creative space for staff to come together, for teams to come together, to talk about some of the difficulties and be supported through a process. Rewards and recognition. We have an active quarterly call for recognition by colleagues. This is not by management. Anyone within the organization can nominate a colleague who has performed over and above. They can nominate a project, a group of people over and above. And to be recognized for what you do is, I believe, adds a lot of value to people's mental health, because they recognize and they acknowledge for what they do. And then our wellness days. Annually, the organization has a wellness day, and this is a wellness day we've recently had on the 18th of October, having health checks, chair yoga, Zumba dancing, line dancing, art and music, and karaoke. And it was a fantastic day. It was one of those days on the Cape Mental Health calendar where staff felt it was their time to leave whatever burdens they had at the door and just have a moment for their own mental health and well-being. The second area of our work is to support people with mental health conditions in the workplace. As we know, people living with mental health conditions have a right to participate in work fully and fairly. And the United Nations Convention on the Rights of Persons with Disabilities provide an international agreement for promoting exactly this: the rights of people with disabilities, including people with psychosocial disabilities and intellectual disability, to work. I know our next speaker will be speaking about, some of the measures, but the World Health Organization recommends that we support people in the workplace by providing reasonable accommodation, return to work programs, supported employment initiatives, and we promote these and have as part of our focus on mental health and well-being for persons with lived experience, a job coaching initiative as well. Then the third area of our work, as I said, are mental health interventions, specifically within the corporate environment, across all sectors and the NGO environment. And we have a department and division which specifically focuses on employee assistance and mental health awareness programs that corporates can access. So there's no excuse. We have programs available so that corporates can prioritize mental health in the workspace and place. And we are currently piloting a new initiative called Mental Health First Aid for Educators. And so I've just shown you a recent webinar that was held for employers, held on the 10th of October, to discuss the importance of protecting and promoting mental health in the workplace. It's important. It is no longer negotiable. It is a requirement. So, ladies and gentlemen, it is time to prioritize mental health in the workplace. Mental health is the essence of our brand. So therefore, mental health and wellness of our staff and mental health care users is a serious matter. And it should be in the culture, every work culture, to talk about mental health and unsilence and allow the conversations and safe spaces for staff to be supported on their wellness journey. We want our employees to press the alarm button sooner rather than later, because we know the sooner we intervene, the better the mental health outcomes. No one needs to be burdened on their own. And the organization should be creating these spaces. So for Cape Mental Health, we are in the business of providing mental health, and therefore we need to understand mental health in the workplace. We need to prioritize mental health in the workplace as a lead organization presenting an example of intervention that supports staff to be the best that they can be, to be acknowledged, to be supported. And so when we look at it's time to prioritize mental health in the workplace, for us as a mental health organization, it is important that we prevent, protect and promote and support our colleagues. After all, there is an economic case for us to invest and prioritize mental health in the workspace. We know that 50% of the total societal cost of mental health conditions is driven by indirect costs, such as reduced productivity. I've said this before, 12 billion people, 12 billion working days are lost every year due to depression and anxiety. And it costs over $1 trillion in lost productivity. Deloitte has done a recent study and they've supported this economic case, and they've said that for every $1 invested in mental health, there is a $4.7 return. We have to invest in our employees' mental health and well-being. The earlier that we can intervene and prevent, the better the outcomes and the better the economic benefits for our country, but also industry. And so mental health and well-being are of critical importance and essential for us in the mental health sector and for us as mental health professionals, because without good mental health, we are unable to deliver high quality mental health services of excellence. And so, ladies and gentlemen, let's bring mental health to work as a connector and not as a divider. Let's protect our employees to be the best that they can be, to know that mental health challenges can impact on any one of us at any one time in our lives. None of us are immune. But for employers to create the spaces for good mental health is actually today a call to action. So let's bring mental health to work as a connector and not a divider. Let's continue the conversations about mental health, but specifically within the workspaces. Thank you.
Excellent. Thank you so much, Ingrid. Thank you for sharing so openly. And I just loved the fact that, you have experts in mental health that are supporting each other in the workplace. And yeah, I think congratulations to Cape Mental Health for making, those safe spaces available, but reminding your own employees that while they serve the community, they need to also serve themselves by looking after their own mental health. So thank you so much for sharing. Next, we have Santhana Pillay. Santhana is the Organizational Development Specialist at Minopex and a person with lived experience. Santhana, why does Minopex see mental health in the workplace as a priority? And what steps have been taken to prioritize it?
Good afternoon, all. And thank you, Bharti, for such an important question on a topic that definitely needs more airtime in organizations and across the country. So Minopex operates in a highly stressful industry, and we have recognized that working in such an environment can lead to higher rates of stress, fatigue, and even burnout. As a company, we believe it's essential to support employees' mental health proactively, not only to safeguard their well-being, but also to foster a productive, resilient, and supportive workplace. Traditionally, our focus was mainly on physical health through wellness screenings and the likes, but now we're expanding our wellness offerings and looking at wellness holistically. We are by no means experts in this, but we have made a conscious effort and have taken the steps in the right direction. And our first step is to create awareness, or was to create awareness. So mental health awareness is crucial in breaking down stigmas and creating an environment where employees feel safe to seek help. When mental health issues are ignored or stigmatized, employees may feel that they can't reach out, or they may avoid reaching out, and that then only compounds their stress or what they're experiencing. So to create the awareness, we partnered with the SA Federation of Mental Health to address our employees on what mental health is and educate them about burnout, which was a particular issue when we reached out that time of the year. So by openly discussing these topics, we aim to create a supportive environment there where our employees then feel like it's normal, it's okay to speak about this and normalize the content. Since then, we've taken several practical steps to integrate mental health support within our organizational culture. It has to become part of the culture for it to stick and for employees to feel that it's okay to speak out. So, for example, one of our team building sessions, we collaborated with the SA Federation of Mental Health to facilitate mental health education more on a team level. And this session included discussions on different types of mental health conditions, and it also entailed a group sharing activity that allowed employees to open up about their own experiences or experiences within their families. This created a safe space for employees to connect, and also it built a deeper sense of connection within the team that wasn't there previously. So it was really meaningful session that we had there. This year, we then also implemented the Discovery Healthy Company program as our new employee assistance program. This solution goes beyond just normal EAP support. It's a proactive, holistic well-being solution that covers mental, emotional, physical, financial health, as well as legal support. Our employees now have access to ongoing resources and support, enabling them to proactively manage their wellness. Healthy Company also encourages physical well-being to support mental well-being through rewards and incentives. So encouraging you to go out, take walks, to also join any physical activity programs, and then you get rewarded for that. And we also have a confidential mood tracker that allows Healthy Company to assess how our employees feeling on a daily or weekly basis. And then they proactively reach out should an employee state a few times through the app that they're not doing well. So it's an awesome proactive tool that that's giving us really rich data and is really supporting our employees proactively. What we found in the past was that, yes, we had all the tools in place from an EAP point, but employees didn't feel comfortable to reach out to the EAP. So now our provider is saying, okay, we will reach out to your employees if we notice that there's any challenges. So it's been a real game changer for us. And then on a personal note, as a mental health advocate for the company, I believe that sharing my story is important. So I've been doing that for as long as I can remember, but more so this year, and I'll get into that a bit. But the last initiative that we've recently done with our teams, which I don't want to leave out, is the training that we've had for HR and our managers to help them recognize signs of distress amongst their employees. So managers are now better equipped to identify any changes in behavior or any possible signs of struggle or distress in their team. And of course, this needs to be done with ongoing one-on-one conversations. So we, through our performance management process, encourage managers and employees to have regular one-on-one conversations where the manager and employee can build that sense of rapport with each other and also then feel comfortable to share. Should then a manager notice any changes in behavior or notice something wrong, we have a referral process through our EAP that the managers were also trained on and know how to refer employees should there be a need. So that is something very important, and we'll continue trying to train and educate our leaders and HR teams on giving the accurate level of support and referring where needed. So back to my personal journey, I've been sharing as much as I can on my own story, and I openly discuss my diagnosis of having general anxiety disorder and ADHD with colleagues and my team. Some people feel uncomfortable. Some people say to me, oh, in my community, we push it under the rug because it's not something that we were told we can talk about. So by sharing my journey, I want our employees to feel comfortable and realize, okay, it's okay for me to go and get this help. And then they ask, where do I get the help from? And then we can point them in the right direction as well. So I always say that our brain is like any other organ. And if any other organ in your body is not well, you go to the doctor. So it's definitely the same concept with mental health. If your brain is unwell, seek help, seek out the help and get the right support that you need. By normalizing these types of conversations, I aim to show my colleagues that it's okay. And we are here should you need support, and there are different multiple avenues that employees can reach out to. So importantly, have the conversations, normalize the topic, and it will then become part of your organizational culture. Thank you, Bharti.
Excellent. Thank you, Santhana. That was quite informative. And yeah, it's always wonderful to be able to work with, businesses, to be able to see that once you bring information and awareness into the company culture, and you normalize the conversations, it's allowing people to just, speak out and actually get help in advance, making sure that they know where to reach for help. And thank you for sharing your lived experience. I think it's wonderful to have people comfortably share their lived experience and encourage others to also, speak out so that they get the help they need. Thank you for sharing. Now we will hear from Hermina Patton, who is a human resource, business ethics, and payroll consultant with extensive labor law experience. Hermina, please share some practical steps with regards to reasonable accommodation in the workplace.
Thank you, Bharti, and good afternoon, everybody. I will share my presentation.
Hermina, just speak a bit louder.
Okay, I'll try and speak really, really loud. Good afternoon, everybody, and thank you, Bharti. So we're going to talk about reasonable accommodation. I can get my presentation to work. There you go. So I think it's important that we just reminded very briefly of the legislation that speaks to reasonable accommodation. And the first of those is the South African Constitution. And the South African Constitution, for the purpose of today's discussion, really talks about equality for everybody, as well as protection against unfair discrimination. And then the Employment Equity Act. So the Employment Equity Act speaks on two different levels. First of all, to all employers, irrespective of the size of the company, and all employers are responsible for ensuring that there's no unfair discrimination towards employees. And particularly the definition for employees in this context also includes job applicants, and that's very, very important. And then for designated employers, so designated employers in terms of the current legislation are those employers that employs 50 or more employees or has a turnover that is equal to or exceeds the turnover as set out in Schedule 4 of the Act. Schedule 4 of the Act. And according to the requirements for designated employers in terms of the affirmative action measures that are supposed to be taken, that includes the requirement for reasonable accommodation. And then the third piece of legislation that is important for us is the Occupational Health and Safety Act. And I think that very often people forget that health and safety is a shared obligation and responsibility between employers and employees. So whilst the employer is responsible for ensuring a healthy and safe work environment for all employees, employees are equally responsible to ensure that their actions do not jeopardize the health and safety of their own person, but also those of their colleagues. And then we'll talk about we'll discuss the need to disclose, but it's important to know that employees are not legally obliged to disclose, only when their impairment may in some way directly impact on their own or the health and safety of their colleagues, then they are legally obliged to disclose. So let's look at the definition of reasonable accommodation, which is any modification or adjustment to the job itself, so the job content, the duties, as well as the work environment, to ensure that a person from a designated group, so the designated group that we're talking about is the listed grounds for unfair discrimination as set out in the Constitution and the Employment Equity Act. And that listed grounds or the designated group of employees include those with disabilities, as well as gender, culture, religion, sexual orientation, and that whole list of what we call the listed grounds in the legislation. So it needs to ensure that employees as well as job applicants have the opportunities to enter into the workplace, but also, as Ingrid mentioned, to be able to participate and to be advanced in the work environment. And reasonable accommodation, therefore, is a legal obligation of designated employers in the workplace to ensure equal opportunities. And then to just briefly look at the definition of people with disabilities, and please remember that this is the current definition of people with disabilities in terms of the Employment Equity Act, but if the new legislation comes through, this definition will change. So currently, people with disabilities mean people who have a long-term or recurring impairment, which is physical or mental, and very importantly, their mental and physical conditions must be diagnosed. So these need to be formally diagnosed. We've often seen employees that self-diagnose or even self-medicate, which is a massive, massive problem. So we need to encourage people to have official diagnosis. And then the third aspect of this is that it must substantially limit their prospects for entry into the advancement or the advancement in employment. And substantially limiting means that the nature, the duration, or the effect significantly limits their ability to perform essential functions for the job. Then, very important for employers to know that not all employees with disabilities qualify for reasonable accommodation, and therefore it's very important for employers to ensure that they determine whether a person actually has a disability that will qualify for reasonable accommodation. So the first thing is that the effect of the impairment on the person's ability to perform. Secondly, the work environment, that is the workplace, the location, the office layout, the furniture, the equipment, all of those things that will impact on the employee on a daily basis in their work. And then thirdly, very importantly, employers need to understand which parts of the employee's duties are inherent job requirements, which parts are core to the job and which are not core, so that those could maybe be moved away should it need to be done to assist the employee. But that analysis needs to be done and thoroughly understood. So the question then is the employee or the applicant substantially limited to perform inherent job requirements? And if they are, then they are disabled in terms of the Act, and if not, they're not disabled. Okay, let's look at designated employer obligations in terms of reasonable accommodation. So when should an employer provide reasonable accommodation? The first thing is that they can only do so when a disability is disclosed and reasonable accommodation requested. And very importantly, when we look at disclosure, particularly with disabilities that are not visible, so the psychosocial mental disabilities, people do not declare those. They do not disclose because of the amount of stigma that's still attached to mental disabilities. They don't do it because they are being bullied, they're harassed, they are discriminated against. So there's a lot of environments, and I think that one of the other speakers mentioned that this is a problem. So it's well recognized that people do not disclose because they do not feel safe to disclose. And therefore, I think it's one of the top priorities for employers to create a safe space for employees to be able to disclose. But that can only happen if they trust that management will be handling their information in a sensitive and an appropriate manner. And So employers need to create a culture, a caring culture, where people do feel safe and where they do trust management to do the right thing. So designated employees need to provide the accommodation when it's disclosed and accommodation is requested, or if the need for it becomes self-evident. So very often employees do not disclose, but it becomes very obvious to an employer that there is a need. And then an open discussion is very, very important. And then also when circumstances change, so either the inherent job requirements change or the work environment changes, and that impacts on the employee's ability to perform the function. And then when is an employer not required to provide reasonable accommodation? So employers are not obliged to provide accommodation if employees don't disclose. And this is why it's so important for us to encourage employees to disclose, because if I could maybe compare it to situations where there are employees with an addiction or a dependency, if they disclose, then we can deal with it in terms of an incapacity process, which is a no-fault process. But if they don't disclose, then employers are forced to deal with it in terms of, so if there's problems, to deal with it in terms of disciplinary processes or performance counseling processes, which are pretty unpleasant processes. So once again, employees must be encouraged to disclose their disability, and we need to provide the safe space for that. And then employers also don't need to do it if it is going to impose an unjustifiable hardship on the business. And that means that the required accommodation will impose a significant cost, or is just too complex and difficult to implement. And we do need to check and make sure that whatever we plan to implement actually will be effective and work for the employee. And then also that it doesn't cause undue disruptions to the business operations. And then categories for reasonable accommodation. So there's various categories mentioned in the guide provided by the government. The first is the no-tech accommodation. These are either low-cost or no-cost methods. And really, it can be done by everybody, because it just really requires a little bit of thinking, a little bit of consideration for the person, and understanding the needs. So just making a little bit of effort to understand what the needs of the employee is. And then low-tech type of accommodations, those are technologically simple and unsophisticated, and usually already available in the organization. High-tech accommodations, those are very advanced, sophisticated devices and technologies that can be implemented. And then live assistance, which includes personal assistance, and then guide and service animals. So no-tech examples, specific examples, flexible working hours, things like regular breaks and giving employees extra time to complete expected tasks, providing an enclosed office instead of open plan seating, or just putting up dividers, and simple adjustments to tasks to include things like checklists or color coding to simplify operational procedures for employees. And then adjusting policies and procedures, and don't forget to also adjust common practices in the organization. And then low-tech examples are things like changing the types of lighting used in a building, or just providing more natural light for them. changing chairs or workstations, or just adding a footrest, providing a safe and calm rest space. And this is very, very important for employees with sensory overload or sensory sensitivity. We'll talk about that. I'm not too sure we will have time, but in the new definition, sensory issues are also mentioned as a disability. And then high-tech examples, things like recorders for recording or reviewing meetings, remote training sessions or remote job coaching, and then live assistance examples is in-person coaching. And then to conclude, just a reminder, we need to look at our policies, procedures, and practices. We need to encourage disclosure by providing a caring culture. We need to understand how to determine if an employee qualifies for reasonable accommodation. We need to have open discussions with employees. And this is so, so important, because together we can find the most practical and cost-effective solutions that works for the employee and for the employer. And remember to always have follow-up and regular discussions. And then also importantly, from an HR point of view and a legal point of view, always put the agreement and the conditions for the reasonable accommodation in writing, and to review those regularly. It's not a once-off. These need to be reviewed and adjusted as needs change. And then remember, reasonable accommodation is not a choice for designated employers. It is a requirement in the legislation. And that is it from me. Thank you, Bharti.
Thank you, Hermina. That was a very, very nice way to make the legalities sound very understandable, easily digestible. So thank you so much for sharing. So we now come to a session which is called the rapid fire round. I'd love to hear from each of our speakers, what's your one wish for workplaces in South Africa with regards to mental health? Who wants to go first?
It's Ingrid. I don't mind going first.
Thank you,
I feel like
Ingrid.
thank you. I feel like I want to be like Martin Luther King, who said, I have a dream. You know, I have a wish, I have a dream that soon and very soon, every workplace across all sectors have accessible mental health and wellness programs available to all the employees. Whether it's managed by the HR department or whether it is outsourced to organizations such as the South African Federation for Mental Health or Cape Mental Health or any one of the amazing mental health societies across South Africa, that all employers will have a policy and procedure, a structure, a formal structure to implement these mental health and well-being programs, counseling, awareness raising, that time is made and set aside for wellness days, for EAP services in a confidential and private and space, and that there's a commitment to compassionate training and awareness by all other employees so that we can support rather than shame, and that there is a commitment to address mentally harmful environments and remove those, eliminate those, and provide mentally healthy spaces. That's my dream.
That's a mouthful and a great wish. Thank you, Ingrid. Santhana?
Go next. Thank you. Wow, thank you for that, Ingrid. Don't know how I'm going to go after that, but my wish is to reduce the stigma. I think it's the first step to creating a healthy workplace where employees can feel comfortable to just speak openly and share their challenges, for sharing of emotions to not be seen as a weakness, but rather used as a strength for us to connect with each other. Connectedness is essential for all human beings, and by us being able to share our journeys, we build the bond with our colleagues, and we're able to just reach a different level of productivity and support in the environment. So by reducing the stigma and creating safe spaces for our employees to share their challenges and their journeys, and like Ingrid said, where we don't feel shame, where you feel proud to stand up and say, I have ADHD, it's my superpower, rather than feel I have to hide something like that. So definitely, please try and encourage, have conversations to reduce the stigma by just speaking openly. Thank you.
Thank you very much, Santhana. Love the superpower. Excellent. Thank you. Hermina.
Thank you, Bharti. Yeah, Aladdin and 3 wishes. So I do hope that all 3 of our wishes can come true. But mine is that for employers to recognize the fact that no matter what the size of the organization, chances are about 100% they do have employees with mental health challenges. And a lot of employers just won't even recognize that fact, or are not willing to admit that they do have employees with mental health challenges. And that even if they are not designated employers, that they have an ethical approach to reasonable accommodation, and that they can implement at least the no-tech reasonable accommodation requests, because those are doable for any organization. It really just does not take any money. It just takes a little bit of effort and care to implement those. And then importantly, for those employers who are currently designated employers, when the new legislation comes in, and I'm not saying if, when the new legislation comes in, and they are no longer designated employers, that they will still continue to offer, at the very least, the no-tech reasonable accommodation to employees, and that they don't just say, well, now we're no longer designated employers, we do not have the legal obligation to comply with the affirmative action requirements, and therefore we're going to ignore it. So those are my wishes, Bharti.
Thank you, Hermina. I love the ethical consideration. And yes, it may not always be legally required, but it's human nature to care. And I love that aspect coming in. And yes, as the moderator, I want to be able to say your wishes shall be granted, because the more we speak about this, the more we share and the more we get together and remind each other of our obligations to be human and to care for one another, I think, we will make this world a better place, starting with the workplace. So thank you so much for sharing your wishes. We open up now for the Q&A session. I have not looked at any of my chats. Are there any questions that have been posted? Michelle O'Shani?
No questions have been posted anonymously, Bharti, just yet.
Okay. Thank you. Can I open up and ask if anyone is or has a question that you want to pose to any of the speakers? I think, Lamise, you have your hand raised. You can go ahead and ask your question.
Good afternoon, everyone, and thank you so much to all 3 speakers for your presentations. Was really insightful. I have a question. I'm not sure if it's directly for Hermina, but it's regarding the reasonable accommodation in the workplace. Hermina or any of the speakers, we can share some advice or guidance when an employee um, informs the employer that I feel stressed, I feel overwhelmed, I'm not coping. It is quite a demanding portfolio. How does one go about in terms of the labor law? What kind of processes does one need to follow in terms of supporting this person that have sent you a message to say, I'm struggling, I feel overwhelmed? Yeah, if you can maybe just provide some tips and guidance on how to support this person.
Thank you so much, Lamise. So my recommendation is at that point when an employee reaches out to management to say, I'm not coping, I think because at that point it's not yet a legal requirement because the employee hasn't been diagnosed with any condition. But it's a very important place for an employer to show caring and to offer some sort of support. Now, it will depend on the type of work environment, the type of organization, but my recommendation is that organizations should, number one, have a list of practical resources that they can refer employees to. Number two, if the organization is participating in a medical aid, for example, Discovery Medical Aid, but I know that the other medical aids have it as well, they have free counseling sessions. And even if the organization is a participating employer in a retirement and risk type funding option, some of those also have free programs included, but a lot of employers are not even aware of the fact that those free options are included in the packages that they get from their fund or risk administrators, and there's free counseling involved there as well. So medical aids and then the funds often have free counseling sessions. And then I think if an organization is able to, also maybe have a budget where they can supplement additional counseling sessions for employees. And then also to help employees to maybe help them with training courses in time management, in stress management, those type of things. And then lastly, I think that it's also important for employers to provide restful and peaceful spaces for employees. And that does not have to cost money, because if there's already a tea room or a canteen or some small space in the organization, and by doing simple things like just having simple colors, calming music, just have a space where people can take a break. And there's a lot of studies that shows how a space in that and spending 15 minutes in a space like that can reduce stress and anxiety for employees. And as I say, those things can be done with minimal costs. And so there are things that you can do for an employee reaching out before it becomes a legal obligation for which an employee then requires a particular diagnosis. So I hope that answers your question.
Thank you. Thank you. It was very helpful. Thanks.
Thank you, Lamise. That was an excellent question. And thank you, Hermina. Yeah, very insightful. We do have a comment and a question in the chat where it says there seems to be a lot of companies that are setting themselves up as offering mental health services. But how do we ensure that this doesn't become a money-making opportunity? So is there an oversight body for companies offering mental health or wellness services that fall outside medical HPCSA models? Not that I'm aware of, and I think it's something we could always explore and maybe get some answers to that question. I'm not sure if the speakers want to respond.
Bharti, it's Ingrid here. I can respond. I don't know of any, body that obviously oversees all these organizations that they have to register with. They're probably registering with their own professional councils, particularly the counselors, I would imagine. But outside of the medical and HPCSA model, there are the mental health societies, and we are specialists in our field. And the one advantage that we do have is we provide free mental health services to those who can't afford, and obviously to companies. We say, the costing is done in such a way that obviously the mental health society providing the mental health services will be paid, but that funding received cross-subsidizes the very services they provide in very dire resource disadvantaged communities. So it has a twofold advantage. A, for the company who needs the support, and then obviously the monies that we receive go to the communities in which we work. So, but I don't know of any, structure or oversight body for organizations in this field. But for mental health organizations, as I said, it's our specialization. So on the one hand, we provide free mental health services, and on the other hand, for our corporate work, we do charge.
Thank you very much, Ingrid. We do have a minute. Looking at Fiona Goliath, you have your hand up.
Yes, thank you so much. Good afternoon, and thank you to the speakers. My question is just about the recourse. So this question would go to Hermina, I suppose. The recourse for employers that don't adhere to the reasonable accommodation mandates. So apart from going via unions, etc., is what are the recourses that can be taken by employees, and what are the channels through which those are served? Thank you.
Sure, Fiona. Yes. So at the moment, with the Employment Equity Act as it is, the recourse that an employee can take really is, number one, to submit a grievance to management. And that normally people are quite scared to do, to tackle the company itself. But if that fails, then the CCMA. So as far as I know, those are the only two recourses at this stage. And then if it fails at the CCMA, it will go further, but in terms of the legal system. But employees should really start with a discussion with management, and if that is ignored, to use the channels such as grievance procedures. And then they do need to exhaust what is available, the processes that's available within the organization before they go to the CCMA. But those are basically the steps that an employee can take.
Thank you very much.
Thank you. Thank you very much. I want to take this opportunity. I think I did promise we will end at 1. Lemise, did you have a very pressing question? Maybe put it in the chat and we'll get back to you.
Okay, that's fine. Thanks.
Okay. I want to thank everyone, all our speakers who have shared with us these very interesting and practical ways in which organizations, both public and private, have prioritized mental health in the workplace to ensure the well-being of their employees. We trust you have found the discussions helpful and that you can get involved to contribute towards making your workplace mentally healthy. Thank you for joining us today. We will share the recording and the presentations mentioned in the webinar. Thank you very much and wishing everyone a lovely day ahead. Take care.
Good afternoon, everybody.
Thank
Bye-bye.
you. Bye-bye. Bye-bye.
Thank you. Bye-bye.